This medication is used to relieve discomfort, pain, frequent urination, and cramps/spasms in the urinary tract caused by infection or medical procedures. Methenamine is an antibacterial drug, and methylene blue is an antiseptic. Both help prevent the growth of bacteria in the urine. Salicylate is a pain reliever, and this product also contains an ingredient to make the urine more acidic, which helps methenamine work better. Hyoscyamine is an antispasmodic drug that relaxes the muscles of the urinary tract to relieve cramps/spasms. This medication should not be used to treat a urinary tract infection. It is not recommended for children younger than 6 years old. When taking Urneva 120 mg, 10.8 mg, 40.8 mg capsule urinary antispasmodics, it's important to follow your doctor's instructions. Typically, this medication is taken 4 times a day with a full glass of water. After taking the dose, it's recommended to wait at least 10 minutes before lying down. It's also important to drink plenty of fluids, unless your doctor advises otherwise. If you experience stomach upset, taking this medication with food may help. The dosage will be determined based on your medical condition, age, and how you respond to the treatment. It's important not to increase your dose or use this medication more often or for a longer period than prescribed. Taking antacids may decrease the absorption and effectiveness of this product, so if you're also taking antacids, take this medication at least 1 hour before. For the best results, take this medication at regular intervals each day. Try to take it at the same times every day to help you remember. It's also important to avoid consuming large amounts of caffeine, as it can increase the side effects of this medication. If your condition doesn't improve after a few days or if you develop signs of a urinary tract infection, such as burning, painful, or frequent urination, be sure to consult your doctor. If you experience nausea, vomiting, dry mouth, dizziness, drowsiness, blurred vision, or constipation while taking Urneva, it's important to let your doctor or pharmacist know. To help relieve dry mouth, you can try sucking on sugarless candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. This medication may cause your urine and sometimes stools to turn blue-green, but this is harmless and will go away when you stop taking the medication. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Be sure to tell your doctor right away if you experience hot, dry, flushed skin, decreased sweating, eye pain, difficult urination, or signs of kidney problems. Seek medical help immediately if you experience serious side effects such as easy bruising or bleeding, black or tarry stools, stomach or abdominal pain, vomit that looks like coffee grounds, or signs of liver problems. In rare cases, this medication may cause a dangerous spike in blood pressure, which can be fatal. If you experience severe headache, fast or irregular heartbeat, chest pain, vision changes, or signs of a severe allergic reaction such as rash, swelling, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you notice anything unusual, be sure to contact your doctor or pharmacist. Remember to always consult your healthcare provider for medical advice about side effects. Before taking Urneva 120 mg, 10.8 mg, 40.8 mg capsule, let your doctor know if you are allergic to any of its ingredients or other medications, as this product may contain inactive ingredients that can cause allergic reactions or other issues. Also, inform your doctor about your medical history, especially if you have kidney or liver problems, urinary blockage, difficulty urinating, stomach/intestinal disorders, glaucoma, heart problems, high blood pressure, myasthenia gravis, bleeding/clotting problems, certain enzyme deficiencies, asthma, growths in the nose, stroke, adrenal gland tumor, or dehydration. This medication may cause dizziness, drowsiness, and blurred vision, so it's important to avoid driving, using machinery, or doing activities that require alertness or clear vision until you can do them safely. Limit alcohol and marijuana use, and avoid overheating in hot weather. In addition, tell your doctor about all the products you use before having surgery. Children and older adults may be more sensitive to the side effects of this drug, so it's important to monitor them closely if using Urneva 120 mg, 10.8 mg, 40.8 mg capsule. Pregnant women should discuss the risks and benefits of using this medication with their doctor, as it may harm an unborn baby and cause problems with normal labor and delivery. It is not recommended for use after 20 weeks of pregnancy, and the medication may also pass into breast milk and have undesirable effects on a nursing infant. So, consult your doctor before breastfeeding if you are using this medication. It's important to be aware of any potential interactions Urneva may have with other drugs. For example, Urneva may interact with products such as aproclonidine, atomoxetine, bupropion, carbamazepine, methotrexate, potassium capsules/tablets, and certain Parkinson's disease drugs. It may also increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. Additionally, taking other MAO inhibitors with this medication may cause a serious, possibly fatal, drug interaction, so it's important to avoid other MAO inhibitors during treatment with this medication. It's also important to report the use of other drugs that may increase the risk of extremely high blood pressure when combined with Urneva, including herbal products, nasal decongestants, and stimulants. If you are also taking azole antifungal drugs, it's recommended to take Urneva at least 2 hours after the antifungal drug. Moreover, it's crucial to check all prescription and non-prescription medicine labels carefully since many medications contain ingredients that may interact with Urneva. Lastly, it's important to tell your doctor or pharmacist if you are taking other products that cause drowsiness, and to be aware that this medication may interfere with certain lab tests, possibly causing false test results. If there is an overdose and the person is experiencing severe symptoms such as passing out or having trouble breathing, it is important to call 911 or a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of overdose may include fever, fast or pounding heartbeat, severe dizziness, seizures, slowed or shallow breathing, and unusual excitement. This medication is not to be shared with others. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take 2 doses at once to make up for the missed one. It's important to store Urneva 120 mg, 10.8 mg, 40.8 mg capsule urinary antispasmodics at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it's expired or no longer needed, be sure to properly discard the product. You can consult your pharmacist or local waste disposal company for the best way to do this. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.